The moment you turn 70, your body crosses a critical biological threshold. 7 specific changes begin occurring in every person who reaches this age, regardless of genetics, exercise habits, or diet quality. These aren't diseases you can prevent through healthy living. They're fundamental biological shifts programmed into human aging that happen to everyone. According to research from the National Institute on Aging tracking over 15,000 adults through their 70s and 80s, these changes accelerate dramatically after 70 compared to the 60s, fundamentally altering how your body and brain function. What makes understanding these changes absolutely crucial is recognizing which changes represent normal aging versus signs of disease requiring medical intervention. This knowledge prevents unnecessary anxiety when normal age-related changes occur while ensuring you seek appropriate care when symptoms exceed normal aging patterns. Research published in JAMA Internal Medicine examined successful versus problematic aging trajectories after 70. Studies found that people who understood, accepted, and actively adapted to inevitable age-related changes maintained independence and quality of life significantly longer than those who fought against these changes or denied them entirely. In this video, we'll examine 7 biological changes that happen to everyone after 70, with particular focus on brain and cognitive changes because your brain health determines your independence, safety, and quality of life more powerfully than any other factor. Number 4 involves structural brain changes affecting memory and thinking speed in ways that surprise most people. Before we begin, understand this information helps you distinguish normal aging from diseases like dementia requiring medical treatment. If you experience changes more severe than described here or symptoms developing suddenly, consult your physician immediately. Now let's examine what inevitably happens after you turn 70. Change number 7. Your thyroid function gradually declines, affecting metabolism and energy levels. Starting with your thyroid gland, this butterfly-shaped endocrine gland in your neck undergoes significant changes after 70. Your thyroid produces hormones T3 and T4 that regulate metabolism in every cell. These hormones control how fast you burn calories, how quickly your heart beats, and your energy levels throughout the day. After 70, your thyroid gland develops structural changes. The gland may develop nodules, small lumps that are usually benign. Thyroid tissue becomes more fibrous and less functional. Hormone production often decreases slightly, even without diagnosed thyroid disease. TSH levels, the hormone stimulating your thyroid, may fluctuate more than in previous decades. Research from the Journal of Clinical Endocrinology examined thyroid function in over 8,000 adults. Studies found that subclinical hypothyroidism, slightly elevated TSH with normal T4 levels, increases dramatically after 70, affecting 10 to 15% of adults in their 70s and 20 to 25% of those over 80. This represents borderline low thyroid function that often goes undiagnosed. The functional consequences include slightly slower metabolism, making weight management more difficult. You burn 100 to 200 fewer calories daily than at age 60, even with the same activity level. You feel colder more easily, needing warmer indoor temperatures and more clothing layers. Energy levels decrease noticeably. You tire more easily from activities that were previously manageable. Some people experience mild constipation, dry skin, or thinning hair as additional symptoms. What makes thyroid changes important is distinguishing normal age-related decline from clinical hypothyroidism requiring treatment. Mild TSH elevation between 4.5 and 10 with normal T4 often doesn't require treatment if there are no bothersome symptoms, but TSH above 10, low T4 levels, or significant symptoms including severe fatigue, unexplained weight gain despite reduced eating, profound cold intolerance, or depression warrant thyroid hormone replacement therapy. What you can do is get thyroid function tested regularly, typically every 2 to 3 years after 70 or whenever concerning symptoms develop. Standard tests measure TSH and free T4. Ensure adequate iodine intake through diet. Good sources include iodized salt, seafood, dairy products, and eggs. If you develop hypothyroidism requiring treatment, levothyroxine replacement is straightforward and effective. Take medication consistently every morning on an empty stomach. Regular monitoring ensures your dose remains appropriate as your needs change over time. Change number 6. Your bladder capacity decreases and control becomes more challenging. Your bladder, the muscular organ storing urine, undergoes structural and functional changes after 70 that affect daily life significantly. The detrusor muscle in the bladder wall becomes less elastic and more fibrous. Bladder capacity decreases from approximately 500 to 600 milliliters in younger adults to 300 to 400 milliliters after 70. This means your bladder physically holds less urine before you feel the urge to void. Additionally, bladder muscle contractions become less coordinated and predictable. The bladder may contract involuntarily when only partially full, creating sudden, urgent needs to urinate immediately. Sphincter muscles controlling urine release weaken progressively, especially in women after menopause when estrogen decline affects pelvic floor muscle tone. In men, prostate gland enlargement, called benign prostatic hyperplasia, obstructs urine flow, causing incomplete bladder emptying and frequent urination. Research from the Journal of Urology examined bladder function in adults over 70. Studies found that 50% to 60% of women and 40% to 50% of men over 70 experience some degree of urinary urgency or frequency. Nocturia, waking at night to urinate, affects 70 to 80% of people over 70, with an average of 2 to 3 nighttime bathroom trips interrupting sleep. The consequences significantly impact quality of life in multiple ways. Frequent urgent needs to urinate limit travel, social activities, and time away from readily accessible bathrooms. Fear of accidents causes anxiety and social isolation as people avoid situations where bathrooms aren't immediately available. Interrupted sleep from nocturia causes daytime fatigue, impaired cognition, and increased fall risk when navigating to bathrooms in darkness. What makes bladder changes important is distinguishing normal aging from pathological conditions requiring treatment. Normal aging causes gradual increase in frequency and mild urgency, but maintains continence with only occasional rare accidents. Pathological conditions, including overactive bladder, urinary tract infections, bladder cancer, or neurogenic bladder from dementia or stroke, cause severe urgency, frequent accidents, pain with urination, or blood in urine. What you can do is implement bladder training techniques. This involves scheduled voying, urinating on a regular schedule like every 2 to 3 hours rather than waiting for urgency. Gradually extend intervals between bathroom trips to retrain your bladder to hold more. Practice urge suppression. When you feel urgency, pause, breathe deeply, contract pelvic floor muscles, and wait for the sensation to subside before walking calmly to the bathroom rather than rushing. Limit bladder irritants, including caffeine, alcohol, artificial sweeteners, and acidic foods, which irritate bladder lining. Stay well hydrated with 6 to 8 cups of fluids daily. Restricting fluids worsens problems by concentrating urine. Stop fluid intake 2 to 3 hours before bedtime to reduce nocturia. For women, pelvic floor physical therapy strengthens muscles supporting bladder control. Kegel exercises should be done daily. For men with prostate enlargement, medications including alpha blockers like tamsulosin improve urine flow. Change number 5. Breast tissue changes increasing cancer risk in both women and men. Breast tissue undergoes significant changes after 70 that increase cancer risk. In women, breast tissue composition changes dramatically after menopause. Dense fibroglandular tissue producing milk decreases substantially and is replaced by fatty tissue. Breasts become less dense and softer. While decreased density makes mammograms technically easier to read, cancer risk paradoxically increases with age. According to the American Cancer Society, breast cancer incidence rises continuously with age. A woman's lifetime risk is approximately 1 in 8, with the majority of cases occurring after 60. At age 70, annual breast cancer risk is approximately 1 in 26 compared to 1 in 50 at age 60. The mechanisms increasing cancer risk include cells accumulating DNA damage and mutations over decades. DNA repair mechanisms become less efficient with age. Immune surveillance detecting and destroying abnormal cells declines. Chronic inflammation increases, promoting cancer development. Research from the Journal of Clinical Oncology examined breast cancer in women over 70. While incidence increases, cancers diagnosed after 70 are often slower growing, less aggressive types. However, they're frequently diagnosed at later stages because screening rates decrease after 70, and symptoms are sometimes attributed to normal aging changes rather than cancer. In men, breast tissue also changes with age. Although men have minimal breast tissue, they can develop breast cancer. Male breast cancer is rare, less than 1% of all breast cancers, but incidence increases with age. Average age at diagnosis is 68. Risk factors include family history, BRCA gene mutations, obesity, and liver disease. What you can do is continue regular breast cancer screening. Current guidelines recommend mammography every 1 to 2 years for women aged 70 to 74 with average risk. For women over 75, screening should continue if life expectancy exceeds 10 years. Discuss individualized screening plans with your doctor based on your overall health status. Perform monthly breast self-exams looking for lumps, skin changes, nipple discharge, or nipple inversion. While self-exams don't reduce mortality, they increase breast awareness. Report any changes to your doctor promptly. Maintain healthy weight as obesity increases breast cancer risk. Exercise regularly, with studies showing 150 minutes weekly of moderate activity reduces breast cancer risk by 10 to 20%. Limit alcohol to 1 drink daily maximum for women. Change number 4. Your brain undergoes structural changes affecting memory, processing speed, and executive function while preserving other abilities. This change has the most profound impact on independence and quality of life. After 70, measurable structural changes occur in your brain, affecting cognition in specific, predictable ways. Your total brain volume decreases at an accelerated rate of approximately 0.5% to 1% per year after 70, compared to 0.2% to 0.3% in your 60s. This represents 5% to 10% total brain volume loss per decade after 70. This progressive atrophy affects specific regions more severely. The prefrontal cortex, responsible for executive functions, including planning, decision-making, working memory, and impulse control, shows substantial volume loss. The hippocampus, essential for forming new episodic memories, shrinks 1 to 2% yearly. White matter connecting brain regions shows progressive deterioration, visible as hyperintensities on MRI scans. Research from Neurobiology of Aging tracked 500 healthy adults over 70 with annual MRI scans for 10 years. Frontal lobes lost 8 to 12% volume. Temporal lobes, including hippocampus, lost 10 to 15%. White matter damage increased progressively. Critically, these substantial changes occurred in cognitively normal people without dementia, living independently. The functional cognitive consequences are specific and predictable. Processing speed, how quickly you perceive information and respond, slows measurably. Tasks requiring seconds now take minutes. Multitasking becomes significantly harder. You cannot handle multiple information streams simultaneously as effectively. Divided attention suffers. If you're doing something and get interrupted, you lose track more easily than before. Memory changes are selective. Episodic memory for specific events declines. You forget conversations from yesterday or where you put objects. Working memory, holding information temporarily, becomes less efficient. Following complex multi-step instructions is harder. But semantic memory, your accumulated knowledge and vocabulary, remains intact or grows. Procedural memory for learned skills stays preserved. You might forget what you ate for breakfast, but can still play piano beautifully or discuss history eloquently. Word finding difficulty, the tip of the tongue phenomenon, increases noticeably. You know the word you want, but cannot retrieve it immediately. This results from slowed retrieval and reduced connectivity between language regions. Importantly, the word usually comes to you later, distinguishing this from dementia where words are permanently lost. Control vascular risk factors aggressively. What benefits your heart benefits your brain. Maintain blood pressure below 130/80, control diabetes with A1C below 7%, manage cholesterol with statins if prescribed, stop smoking, limit alcohol to 1 to 2 drinks daily, and maintain healthy weight with BMI between 18.5 and 25. Vascular damage accelerates cognitive decline beyond normal aging. Change number 3. Your digestive system slows, causing bowel irregularity and nutrient absorption decline. Your gastrointestinal system undergoes changes after 70, affecting digestion and elimination. Peristalsis, wave-like contractions moving food through your digestive tract, slows throughout the system. Stomach emptying takes longer. Small intestine transit time increases. Colonic transit slows substantially, sometimes taking 3 to 5 days for food to travel from ingestion to elimination, compared to 1 to 2 days in younger adults. These changes result from multiple mechanisms. Smooth muscle in GI tract walls decreases, and remaining muscle contracts less effectively. The enteric nervous system controlling gut motility loses neurons. Production of digestive enzymes from pancreas, liver, and intestinal cells decreases. Stomach acid production declines by 30 to 50%. Research from the American Journal of Gastroenterology found that over 40% of people over 70 experience chronic constipation. Early satiety, feeling full after small amounts, affects 25 to 30%. Heartburn increases despite lower stomach acid because the lower esophageal sphincter weakens. Additionally, nutrient absorption declines. Vitamin B12 absorption decreases substantially because stomach acid and intrinsic factor needed for B12 absorption decline. Calcium absorption decreases. Iron absorption is impaired. Vitamin D activation in the gut is less efficient. What you can do is increase dietary fiber gradually to 25 to 30 grams daily through vegetables, fruits, whole grains, beans, and legumes. Drink adequate fluids, at least 8 cups daily. Stay physically active as movement stimulates gut motility directly. Eat smaller, more frequent meals if early satiety is problematic. Avoid lying down for 2 to 3 hours after meals to prevent reflux. For nutrient absorption, take vitamin B12 supplements as absorption from food becomes insufficient. Get adequate calcium, 1,200 milligrams daily, and vitamin D, 800 to 1,000 IU daily. Discuss with your doctor whether you need screening for vitamin deficiencies through blood tests. Change number 2. Your sleep architecture fundamentally restructures, affecting brain waste clearance and dementia risk.
Sleep patterns change dramatically after 70, with direct connections to brain health and dementia risk. Deep, slow-wave sleep, the most restorative stage, decreases 50% to 75%. You spend only 5 to 10% of sleep time in deep sleep, compared to 20 to 25% in younger adults. Sleep becomes fragmented, with 20 to 30 brief awakenings nightly. Total sleep time decreases to 6 to 6.5 hours. Sleep efficiency drops from 90% to 95% in young adults to 70 to 80% after 70. The mechanisms involve brain changes. Your suprachiasmatic nucleus, the master circadian clock in the hypothalamus, loses neurons and function. Circadian rhythms weaken, making sleep-wake timing less consistent. Melatonin production from the pineal gland decreases 50 to 70%. Lower melatonin makes sleep initiation and maintenance harder. Brainstem nuclei controlling sleep-wake transitions change, causing lighter sleep and more awakenings. What makes sleep changes particularly critical for brain health is that deep, slow-wave sleep is when your brain clears toxic metabolic waste through the glymphatic system. This waste clearance system is most active during deep sleep, removing beta-amyloid protein that accumulates in the brain. Beta-amyloid forming plaques between neurons is the pathological hallmark of Alzheimer's disease. Reduced deep sleep means less efficient clearance of these toxic proteins night after night, year after year. Research from JAMA Neurology followed people over 70 for 15 years, measuring sleep quality with actigraphy and tracking dementia diagnoses. Those with severely fragmented sleep and very low amounts of deep sleep had 1.5 to 2 times higher dementia risk over the follow-up period. The connection is bidirectional, creating a vicious cycle. Poor sleep increases dementia risk through impaired waste clearance, and developing dementia further worsens sleep quality through damage to sleep-regulating brain regions. What you can do is optimize sleep hygiene despite inevitable age-related changes. Maintain absolutely consistent sleep-wake schedules, going to bed and waking at the same times daily, even on weekends. This consistency strengthens weakened circadian rhythms. Get bright light exposure, preferably sunlight, in the morning for 30 to 60 minutes. Light is the most powerful circadian rhythm regulator. Avoid bright lights and electronic screens for 2 hours before bedtime, as blue wavelengths suppress melatonin. Keep your bedroom cool at 65 to 68 degrees, dark and quiet. Use blackout curtains or eye masks. Consider white noise machines to mask disruptive sounds. Avoid caffeine after noon, as effects last 6 to 8 hours. Avoid alcohol in evenings. While alcohol causes initial sedation, it fragments sleep and reduces deep sleep dramatically. If sleep problems are severe or accompanied by loud snoring and breathing pauses, discuss with your doctor. Sleep apnea is treatable and significantly improves cognition when treated. Avoid long-term use of sedative sleep medications, as these impair memory and increase fall risk. Change number 1. Your immune system becomes less effective, increasing infection susceptibility and cancer risk. Your immune system undergoes dramatic changes after 70 in a process called immunosenescence. Your thymus gland, where T cells mature, shrinks to only 10 to 15% of its maximum size. Production of new naive T cells decreases substantially. Existing immune cells don't function as effectively. They respond more slowly to infections and produce lower quality antibodies. Chronic low-grade inflammation increases, exhausting immune resources. Research shows adults over 70 have 50 to 70% reduced immune responses. This manifests as increased susceptibility to infections, including pneumonia, influenza, urinary tract infections, and skin infections. Infections are more severe and last longer. Recovery takes more time. Additionally, immune surveillance, detecting and destroying cancer cells, declines, increasing cancer risk across all types.
Vaccine effectiveness also declines substantially. Standard flu vaccine produces protective responses in 70 to 90% of young adults, but only 30 to 40% of adults over 70. This is why high-dose flu vaccines were developed specifically for seniors. What you can do is get recommended vaccines, including annual high-dose flu shots for seniors, pneumonia vaccines, including both PCV20 and PPSV23, shingles vaccine, Shingrix, and updated COVID vaccines. Practice rigorous hand hygiene, washing hands frequently with soap for 20 seconds. Avoid close contact with sick people. Seek prompt medical attention for infections. Don't dismiss fever, cough, or infection symptoms as minor. These 7 changes happen to everyone after 70. Understanding them allows you to adapt and maintain quality of life despite inevitable aging. Which change surprised you most? Have you noticed any of these in yourself or loved ones? Share your experiences in the comments. If this helps you navigate aging successfully, please like and subscribe for more evidence-based health content for seniors.